Okay.
Okay.
All right, thanks.
No problem.
Test, test, test. Okay. Okay, welcome everybody. If you would, click on the chat box here. Tell me if you can hear me. Okay, we got a couple to hear. There we go. Good, very good. Somebody said I wasn't real clear the last time. I don't know if it was just that person's or what. So hopefully it's clear. Good. Okay, this is going to be a lively chat this time. So we will go ahead and jump right into it here. Okay. Now what? Chat box is hiding. I don't know why it does that. Sometimes it hides it. Okay. Guess we'll go over there a little bit. Okay, does everybody see the screen here? Okay, good, good. All right, welcome. We're going to learn a few things about milk today. Does milk do a body good? Milk has for years been touted as the perfect food. I would agree for babies of the same species. Especially, it may even be great for other species under certain circumstances. For example, human milk is about 1 part calcium to 1 part phosphorus, the same as goat and sheep milk. Human milk is 80% whey, 20% casein, but cow's milk is 20% whey and 80% casein. Casein is much larger curd, much harder to digest. Human milk is much higher in butterfat than cow's milk. And they think that relates to the development of our nervous system, especially our brain, so it relates to our intelligence. Cow's milk is about 1 part calcium to 4 parts phosphorus. Drinking cow's milk raises blood calcium. Okay, let's explore that. It's assumed that drinking cow's milk adds density to human bone. However, research demonstrates that the more cow's milk one drinks, the less bone density of both men and women. And if you'd like references on that, email me about it and I'll be happy to send them. We teach that in my part 4. So I'm going to put it up here, drbbrk@hotmail.com. I'll be happy to send you those particular references. Just ask for the references of how cow's milk causes osteoporosis in men and women. And just email me for that, and I'll be happy to send it to you. Why is this so? Because the body can only tolerate a certain range of any nutrient in the blood. Because cow's milk has so high calcium in the body must neutralize it. And this should be phosphorus. I'm sorry, I put the wrong thing down here. Cow's milk has so high phosphorus, the body must neutralize it with calcium drawn from the bone. So sorry about that, but I'll put it in the correction if you want me to email it to you. It raises blood calcium, but it's because it draws from the reserves in the bone. So your body is always looking toward homeostasis, so it's got to neutralize that high phosphorus. All my career, when I've taken x-rays on older patients, I always ask whether they drank milk. The ones with the most dense bones always said never. The ones with the least dense bones always bragged about drinking 2 glasses a day every day of my life. And I'm talking, these are the people where you saw the line around the bone, but the density of the bone looked like the density of the soft tissue outside of it. And that always baffled me. I'm going, something is wrong here. And I knew it was wrong before I knew any of this research, just because of asking questions like that. Now, is raw milk better than processed milk for humans? So we always hear this argument. I'm going to say, well, yeah, kinda, and we'll explore that a little bit. Cow's milk, stale or oxidized versus fresh. Cow's food. How good is cow's milk for calves? Well, research shows that if the cow's diet is mostly from grain and bales of hay, which is stale, the calves do poorly. If the cow's diet is from grazing on fresh grass, the calves do much better. If the diet is mostly fresh grass and the calves take the milk straight from the teat of the udder, the calves do well. If it's milked into a bucket, then given to the calf, it does less well. If it's milked into a bucket, then given to the calf an hour later, it does even less well. If it's milked into a bucket, then given to the calf 3 hours later, it does even less well. So we have fresh from the teat, into the bucket, then an hour after in the bucket, versus straight from the bucket right after it's milked, then an hour later, then 3 hours later, and then they gave it to a day later, and it does even less well. What's the difference? Well, it's oxidized more and more. It's attributed to progressively more oxidation. Therefore, if the same is applied to humans consuming raw milk, the same would apply. Now, vitamin B6 or pyridoxine. Pasteurized milk given to humans depletes B6, and I misspelled pyridoxine there, did it right there and not there, because it denatures proteins, and since B6 acts as a transaminase, it's needed to transform surviving amino acids into ones that were denatured and are thus used up. That should be surviving amino acids that were denatured into other ones. And I'm looking at the typos in here. Anyway, we're correcting it as we go. Since B6 is needed to transform tryptophan into B3 or niacin, this creates a problem with normal B3 metabolism in humans. B3 deficiency causes achlorhydria. Hydrochloric acid is necessary for digestion of animal proteins and keeping blood sugar normal. So when you have a B3 deficiency, because you have a B6 deficiency from giving pasteurized milk, now you got problems with hydrochloric acid. And of course, hydrochloric acid is necessary for digestion of animal proteins and keeping blood sugar normal, which we'll see. Hydrochloric acid is necessary to activate the intrinsic factor, which is necessary to absorb and metabolize B12. B12 and vitamin C are necessary to convert folic acid to its physiologically active form of tetrahydrofolic acid. Among other things, tetrahydrofolic acid suppresses sprue or celiac disease. How many of you knew that tetrahydrofolic acid suppresses celiac disease. Now we just basically learned that celiac disease was from taking wheat, and you have a sensitivity to wheat, but how many of you actually knew that the active form of folic acid suppresses celiac disease? We have 2 no's in there. Who else knew about this? Did you know about it? Did you not know about it? Let's get some feedback here. Only have 2 people answering. Come on, everybody, jump in here. I want to see people answering here. Didn't know. Okay. 0 from Eric up in Chicago. Okay. Okay, it also stimulates production of red blood cells, improves arteriosclerosis, which improves capillary blood flow and vision as a result of better blood flow to the retina. Okay, how many of you knew that folic acid helps eyesight by improving capillary action? How many of you knew that? So you got people with dim vision. How many of you knew that give them folic acid, but you can't just give them folic acid, you have to make it the active form. So therefore, you have to give them metabolically active vitamin C and B12, but the B12, you need hydrochloric acid to activate the intrinsic factor. You need B6 to help make B3 to make that happen. Okay? So you got a whole chain of events here. B6 is also necessary for essential fatty acid metabolism. Even being given instead of essential fatty acids to correct fatty acid deficiency. How many of you knew when you had a fatty acid deficiency, how many of you knew that if you had a fatty acid deficiency, you could just give B6? Because the fatty acids are there, but the B6 is needed to metabolize it. So you got a couple of things going there. What about sublingual B12? Well, possible, but you know, you still need the intrinsic factor to activate and metabolize the B12. It's not just about the absorption, it's about the metabolism. So you still need the hydrochloric acid to make the intrinsic factor active to metabolize the vitamin B12. Okay? So you need all of those factors there. So the intrinsic factor is not just there for the absorption of B12, it's also there for the metabolism of B12. So you have all these interactions going. B6 deficiency induces peripheral neuropathies and carpal tunnel syndrome. Okay? How many of you knew that B6 deficiency induces peripheral neuropathies, and therefore the active form of B6 helps neuropathy? Pato, no and yes. Occipital neuralgia, yes. Okay, that's good. Eric, didn't know. ES, I guess that means yes. Dr. Donaldson, not carpal tunnel syndrome. Yeah, what it does with carpal tunnel syndrome is with the lack of B6, you have a buildup of fluid in the carpal tunnel. And so basically administering B6 helps get rid of the excess fluid in the carpal tunnel and takes the compression out of it. That's what it does. Okay? So abnormal tryptophan metabolites are found in the urine of B6 deficient individuals, including xanthurenic acid, which retard oxidative phosphorylation, which then interferes with carbohydrate metabolism by forming inactive complexes with insulin, causing a diabetogenic acid or chemical diabetes mellitus, reversible by administration of pyridoxine. Okay, so how many of you knew that a deficiency of B6 could cause chemical diabetes mellitus? How many of you knew that? Dr. Donaldson, no. Occipital neuralgia, no. Dr. Thompson, no. Eric, no. Okay, we're all learning something. B6 concentrations are significantly lower in diabetic versus normal individuals, which goes right along with this. Okay, magnesium. Magnesium is necessary as an activator for enzymes of carbohydrate metabolism and amino acid metabolism. Deficiency is seen in diabetes, neuromuscular conditions, and makes animals considerably more susceptible to atherosclerosis. Low levels of magnesium are observed in hearts of patients with myocardial necrosis and more marked in diabetic subjects. So here we're going right back to diabetic subjects right here from B6 deficiency. Or is there more to this? Magnesium activates over 50% of enzymes in the body, including 6 of the 9 glycolytic enzymes. High calcium, protein, and vitamin D intake all function to increase the requirements for magnesium. Look at this. Cow's milk fortified with vitamin D has much more calcium, protein, and vitamin D than human milk. So we're causing a deficiency of magnesium with milk. Okay? Zinc. Zinc supplementation is shown to improve arteriosclerosis. Diabetics excrete more zinc in their urine than normal subjects. Cadmium displaces zinc and interferes with certain enzyme systems requiring zinc. Now, some of you may remember when we talked about calcium supplements. Calcium supplements, and we named several different ones and where it doesn't occur as much. One of the things they have is high amounts of heavy metals: lead, cadmium, aluminum, and copper. Cadmium right here displaces zinc and interferes with certain enzyme systems requiring zinc. Higher ratios of zinc to cadmium are preferable because excess zinc prevents accumulation of cadmium, but a slight deficiency allows it. Dairy products and butter have very low zinc to cadmium ratio in relation to most other foods. So when you're taking a lot of dairy products and butter, then you're throwing off this zinc to cadmium ratio. Okay? Zinc is involved in the granulation and storage of insulin in the beta cells of the pancreas. So when you ingest a lot of dairy products, guess what? You're depleting zinc and you're affecting the granulation and storage of insulin in the beta cells of the pancreas. Now look at this. Dysinsulinemia, a pre-diabetic state, is one of the beta cells of the pancreas being unable to store and granulate insulin. Deficiencies in the exocrine function of the pancreas have long been associated with endocrine insulin deficiencies. So directly here, from dairy products, we're getting into problems with the pancreas itself, both exocrine and endocrine. Abnormal exocrine pancreatic function has been reported in patients with both juvenile and maturity onset diabetes by many investigators. So here we have a link with overconsumption of dairy products, including milk and butter, to both juvenile and maturity onset diabetics. Physical activity levels assessed for individuals in the study were found to correlate with serum HDL cholesterol levels only in the third of subjects with the low zinc intake. HDL cholesterol levels tended to increase most in subjects with higher activity levels, remain constant or decreased several people with low and moderate activity levels. Thus, Moderate levels of zinc supplementation may offset exercise-induced increase in HDL. So when we have a lot of dairy products and it lowers the zinc, then it lowers the ability of physical exercise to work for us. Okay, allergic and maladaptive reactive substances. 2/3 of insulin-dependent adult onset diabetics did not need insulin after they had withdrawn from their maladaptive reactive substances. But I like all these typos in here. Still, those still using insulin required only 1/3 the amount used prior to their workup. So here we may have maladaptive or allergic substances. Poorly controlled obese adult onset diabetics fasted 4 days while monitored. During the fast, blood sugar levels decreased to a normal or near normal level. So here we have evidence that fasting can actually help correct blood sugar levels. Provocative testing, which followed, revealed sensitivities to a number of both carbohydrate and protein foods, which elevated patient blood sugar levels. When patients avoided incriminating foods, insulin requirements decreased considerably, with the majority being able to get along without any insulin. Cow's milk is the largest incriminating food. Okay, so here we have like 3 or 4 things already just from dairy products causing problems with blood sugar and diabetes. Okay, how many of you knew that? Let's have a little feedback here. And the ingestion of cow's milk has gone up, extremely a lot over the past like 30 to 40 years. Okay, we had 1 or 2 that did, several who didn't. Okay, prenatal sensitization from maternal diet. Foods in the mother's diet during pregnancy have been linked to allergy development in the infant. Eggs, wheat, soybean, milk, and peanut, but research demonstrated no more than 2% experienced this. This is similar to gluten allergy percentages, which is about 2% strictly gluten. Okay, allergens in cow's milk. Similarly, cow's milk has an average of 14 allergens from the cow's diet passed to those who ingest it. Cow's milk given to human babies will destroy the baby's kidneys when the baby is too young, due to the underdevelopment of the baby's kidneys and the high amount of minerals in cow's milk compared with human milk. Now, how about breast milk? Antigens passed to the infant through the mother's milk, with the mother ingesting egg and cow's protein. Samples taken at 2, 4, and 6 hours after consumption showed ovalbumin from the egg and beta-lactalbumin detected in the breast milk. So here we have the allergens going straight through into the baby. Mothers fed chocolate, eggs, citrus, wheat, codfish, cows, and goat's milk developed eczema. Okay, how many of you knew that? How many of you knew that eating these things caused eczema in the baby from the mother's breast milk? How many of you knew that? No idea, not at all. Now, I'll give you a story. I had a young mother. She was pregnant the first time, and she was having all sorts of abdominal pain, just constantly. And so I investigated her diet, found out she ate eggs every day. I said, get off the eggs. She got off the eggs, and she did fine. Then she gave birth, and the baby had colic. And the normal way to take care of colic is to put the baby in the window and let it get sunlight about 15 minutes a day. Nothing worked with it. And I remembered her reacting when the baby was in the womb, and I said, "Are you eating eggs again?" She said, "Yeah," and she was breastfeeding the baby. I said, "Well, get off the eggs." About 3 or 4 days, the colic stopped. And then when the child was 9 years old, the father came in, and he started commenting about the son. And he says, "Man, when he rips one, you got to evacuate the house for a whole week. Is there anything you can do for that?" And after laughing my head off, I said, "Do you remember when the baby was in the womb, and when the mother was breastfeeding?" I said, "Are you giving the child eggs?" He said, "Yeah." I said, "Just take the eggs out." All the foul-smelling flatus stopped. And so here I was following personally through from the baby in the womb to breastfeeding to just eating eggs later on, causing trouble at every stage here. Okay? Have any of you noticed similar things from in the womb through to later stages of life? Let's see that in the chat box there. Come on, we need a little bit of feedback here. No. Some, okay. Got some following that. So here we have it from prenatal sensitization in the breast milk. Now, what about goat's milk? We always hear, okay, goat and sheep milk are better than cow's milk. Goat's milk causes allergic symptoms in up to 80% of infants previously diagnosed with cow's milk allergies. How many of you knew that? So goat milk is about as bad as cow's milk, even though it has a lot of similarities to human milk. No. Now, I was in a large shopping center. We had about 100 merchants in it when I first went into practice, and it was owned by the owner of the largest dairy in the state of Kansas. And I found out from talking with the broker for the shopping center that all of his children, he had 9 children, they were all allergic to cow's milk. So they had to give him anything else. And it was funny because he owned the largest dairy in the whole Midwest. Okay, what about homogenization? We've talked about pasteurization. We've talked about allergic potentials. Homogenization of the fats in milk decreases the size of the molecules to about 1/8 normal, enabling it to race through the stomach quickly. When it does that, an enzyme which is rich in the milk fat fails to be digested or destroyed in the stomach. This enzyme is called xanthine oxidase, which is normal in small amounts in the blood. These small fat droplets are directly absorbed into the circulation, creating abnormally large amounts in the blood, which causes scarring of the arterial walls. The body has to patch these with plaques, causing atherosclerosis in the process. Okay? So how many of you knew that homogenization would cause plaquing of the arteries? Drinking a lot of homogenized milk would cause plaquing of the arteries. Okay, we got some say yes, some say no. That's good. Some of you are aware. Artificial coloring. Chalk and red dye, that should be R, used to make milk whiter, so those with red dye allergies would have an issue with this. How many of you knew chalk and red dye are used to make milk whiter? How many of you knew that? Let's see that in the chat box. No. Okay, so most of you didn't know that. So when you're looking at children that are having red dye issues, probably virtually nobody knows that red dye is in that milk. They just don't mention it. Now, milk may be identified on labels as whey or curds or any of the caseinates, like sodium, calcium, magnesium, etc., caseinates. Okay? So those are different ways that you can point out to people about how to identify it. Milk intolerances are linked to, oh boy, man, I got all sorts of spelling issues here. Seizure disorders. How many of you knew milk could cause seizures? How many of you knew milk could cause seizures? Let's see that in the chat box. One, couple of yeses, mostly no. Couple, yeah, there's another yes. Okay. So if you got patients with seizures, immediately just start asking them, how much milk and milk products are you ingesting? Hyperactivity. So I had a couple. They were Jehovah's Witnesses. They and their parents and grandparents, aunts and uncles, and they had 2 children. They were all patients. One day the mother was in and she said, man, you know, our 2 kids, they were little, you know, like 5, 7 years old. They are just kicking and screaming and doing everything. And I said, well, you need to get them off of milk. And so their family got together and they had a conference. And the parents reported back to me, well, everybody thinks you're really great, but you don't know anything about milk because everybody sees those mustache commercials with milk on it. I said, okay, let's do an experiment. Take them totally off of milk products. Don't tell them what you're doing. Milk and cheese, cottage cheese, everything. I told them how to read labels. Take them off for 3 weeks. Just observe. Then without telling them what you're doing, give them a glass of milk and just sit back and watch. And she said they in 3 weeks, actually in about a week and a half, had totally calmed down. And they were sitting there playing nice with each other. They gave them a glass of milk, and they said in 10 minutes they were kicking and screaming and pulling each other's hair. They said, we could not believe it. Just couldn't believe it. Aggression is related to milk intolerance. Violent behavior, chronic depression, diarrhea, abdominal pain, abdominal bloating, dermatitis, rhinitis, asthma, anger, irritability, postnasal drip, pale complexion, dark circles under the eyes, poor concentration, fatigue, insomnia, headaches, juvenile delinquency, anaphylaxis in infants, bronchospasm, urticaria or hives, sleeping problems, immune response mechanisms types 1, 3, and 5. How many of you knew most all of this stuff was related to milk intolerance? Let's see that in the box here. Let's see the answers in the chat box. Occipital neuralgia, no. Some, not all, no, didn't know. The first thing I tell my patients, I tell everybody, get on distilled water, get off of milk. First thing I tell everybody that come in with any big sort of problem. And it's because I knew all this stuff about it. And I would suggest that you do the same. I say, I know you're going to cheat sometimes. Just look at what happens after you start up again. And you'll see why I tell you not to do it. Children who manifest symptoms of cow's milk allergy may still demonstrate high levels of antibodies to the cow's milk protein. Several factors that may impact on the development of cow's milk allergy in the infant: history versus breastfeeding, presence of gastrointestinal disease, familial history of atopic disease. Gastrointestinal problems are considered to be the most common clinical manifestations. The second would be skin issues, ranging from minor inflammation of the lamina propria to villus flattening, with inflammation, diarrhea, vomiting, steatorrhea, abdominal or stomach pain, malabsorption, particularly of zinc and calcium, colonic inflammation, protein-losing enteropathy, and bleeding, either overt or occult. Occult blood loss is considered to be a common problem, area of concern, causing iron deficiency anemia, undetected using a Guaiac test. Pediatric experience demonstrated occult bleeding related to cow's milk ingestion seen in about half of children diagnosed with iron deficiency who reportedly consume large quantities of milk per day of 1 quart or more, which can easily be done, okay? Guess what? Occult bleeding. When you have occult bleeding, that gives you leaky gut syndrome. How many of you knew that leaky gut was associated with milk ingestion? Leaky gut is associated with milk ingestion. How many of you knew that? Okay, 1 yes, 1 didn't know. Come on, yes. Thompson, of course, I've mentioned that before. Those of you who've been watching before. Yes, no, so about maybe a little more than half knew, okay? Respiratory problems. Respiratory problems are another potential manifestation of the cow's milk allergy, including wheezing, coughing, nasal congestion, or draining, though not shown to either produce mucus or affect mucus viscosity. Heiner's syndrome. Specifically defined respiratory disorder associated with milk allergy is characterized by lung infiltrates, elevated levels of eosinophils, high levels of serum precipitants to cow's milk. So when you have elevated eosinophils here, patients may have respiratory and or gastrointestinal problems, anemia, or failure to thrive. Failure to thrive, wait a minute, I thought milk was the perfect food. But you have failure to thrive. Here we have involving type 3 or 4 immune reactions. So now we have type 1, 3, 4, and 5 all being caused by milk so far here. Skin issues. Some patients have skin manifestations such as hives, angioedema, or eczema may react to skin contact with dermatitis. How many of you knew that hives was associated with cow's milk ingestion? Hives. See how patients that have repeated hives. Yes, yes, yes. Okay, so we have several. That's good. That's good. Lactose intolerance. Symptoms that may be due to lactose intolerance include diarrhea, abdominal pain, and abdominal bloating. Arthritides and leaky gut. Rheumatoid and psoriatic arthritis patients cease to be symptomatic within 3 to 4 weeks of elimination. Boy, I'm really spelling good around here, aren't I? Wow. Some shown to be from lactase deficiency, presumably potentiating arthritis by affecting permeability of the intestine in testing. Wow, this is bad. Leaky gut, I got to check my spell checker. So how many of you knew that rheumatoid and psoriatic arthritis could be related to lactase deficiency? Okay, you knew something here. That's good. Didn't know? No? No? Yes? Okay, we got 1 or 2 that yes. Morning stiffness, joint tenderness, and grip strength significantly affect in a deleterious manner with milk challenge. So how many of you knew that morning stiffness, which a lot of adults have, joint tenderness, and grip strength are associated with cow's milk ingestion? So these people who have constant problems having grip problems, morning stiffness all the time, not grip, okay? Didn't know. Okay, we're learning some stuff here. Tell you what, I'm going to clean up the misspellings in this so that, when you ask for this, I'll have the spellings corrected. Hopefully I'll find them all. Okay, erythrocyte sedimentation rate has been shown to improve with milk withdrawal. So So we have a couple of blood tests. Elevated eosinophils and erythrocyte sedimentation rate are elevated because of cow's milk ingestion. How many of you knew that? Didn't know. You're actually human. Thank you for showing your typos. Oh, come on, Eric. I always trip over my words anyway. Okay, some of you knew it, some of you didn't. So we're showing you how to read and interpret blood tests and get very quick results just by getting the people off of cow's milk. Okay? Copper. Milk shouldn't be taken with copper as it interferes with its absorption. So how many of you knew that milk interfered with copper? Now look at that. You got different copper enzymes. Copper is necessary for the cross striations in connective tissue. Thus, when you have a deficiency of copper, you're causing problems with osteoporosis, connective tissue, herniations. Thought Cooper is related to dementia. Who is Cooper, Eric? I don't know who Cooper is. I'm just kidding. At least I'm not the only one misspelling. Okay, that's good. And copper is necessary for maturation of red blood cells. Okay, so here's a problem with making red blood cells. So we got several down the road type of things. Growth hormone. Growth hormone is demonstrated in milk and is not destroyed by pasteurization. Prolonged administration of growth hormone causes osteoporosis. Milk and sucrose combined are diabetogenic. So what do we have? Cereal. We have sugar and milk with our cereal. And we have elevated osteoporosis. Look at this. And this is from growth hormone. Look at that. Okay, how many of you knew that milk had growth hormone even though it was pasteurized, and that caused osteoporosis just by itself? And we already mentioned another thing, from the high level of phosphorus. Everybody knew that. You've been listening to my class for, well, good job, because we mentioned this before. How many of you knew milk and table sugar are diabetogenic when combined? How many of you knew that? Yes? Didn't know? No? Yes? Okay. I mentioned that in class before. So, Hunzes and sour milk. Some of the longest lived societies drink milk, but only sour milk, which have high amounts of probiotics in it. So they get the lactobacillus. They noticed that their people get sick when they eat fresh, so-called fresh milk. So they let it sour first. They found that it actually helps. And of course, it's not pasteurized and homogenized, so it has all the benefits of being able to have the lactobacillus and bifidus and all that sort of thing. How many of you knew that the oldest societies in the world basically only drank sour milk and not fresh milk because they found out it actually helped with health, but the fresh type caused problems with health. Had a few that knew that. Okay, and that's about it for this part of the class. Okay, before we move on to the next part here, okay, anybody have any questions over milk here? Now, we learned a couple of tests that you can look at in blood tests and know why they're having problems being raised. Erythrocyte sedimentation rate, ESR, and eosinophils. So now you can look at those tests and immediately to ask the person, how much milk products are you ingesting? How much dairy, how much milk, how much ice cream, how much yogurt, whatever. Okay? A1 versus A2. I know about those things, but I went over and tried the A2 milk at Brahms, and I didn't seem to react any differently with the A2 rather than A1. And I know they're converting all their cattle to A2, so supposedly it's better. But to me, the jury's kind of all out on that. Okay, how much zinc is a moderate amount? What for taking a supplement? Is that what you're talking about? Supplement, okay. Well, we talked about in previous classes when you take zinc supplements every day, like when people get in the liver to prevent, into winter to prevent colds, it causes a depletion of copper. And I would say, if you already have a cold or something like that, yeah, go ahead and take it, for a week or two. Then back off, and I wouldn't take anything more than, once every, maybe 3 days or a week even, okay? Because when you get too much, then it starts playing havoc with copper, and that starts playing havoc with vitamin C and connective tissue and that sort of thing, because it starts causing imbalances. What about whey and collagen-based protein powders? Well, people can be, even though the casein is more difficult to digest than whey can still cause problems. Collagen-based protein powders, they have some benefits, but to me, when I teach my Part 4 class, I always tell people, we hear a lot of things about nutrition, good and bad stuff and all that, but you have to evaluate each person on their own, and you have to look at them and say, is this a certain susceptible person? And then you got to determine all these factors that go along with it. So I listen to, and this is one of the reasons I give these classes on Thursday, and why I put the films out, and why I give the in-person classes. I want you to get so familiar with things that can help, and being able to identify what's going on, that the patient comes and presents with an issue. You ask a couple of deft questions, and then you know what to do. For example, raised eosinophils and ESRs. Immediately now you know to ask them, hey, how much milk products are you ingesting? And you start going through it. And by the way, most chocolate is milk chocolate, so you're going to get stuff out of that chocolate, okay? Oh, thank you for putting on these classes. You're quite welcome. And one of the things about putting these on, I already know this stuff, but it's just helps me to kind of put it all together in a coherent way, so that they always say a teacher learns 3 times, and it's no different than that with me. But I want you, my kind of mission is in life is, I don't want to have all this knowledge go to waste after I die. I want to pass it on so that I'm helping a whole lot more people than those that I can just see and touch. I want to be able to, through educating all of you, help potentially millions of people, okay? That's what this is about, and I hope you all realize that, okay? And you're welcome for that, okay? Any other questions about milk and any of this that we talked about today? Please have a commercial break about your fantastic videos. Okay, that's coming up here. Okay, so we're going to go out of this. But before we do that, we're going to talk about evidence-based medicine. Because a lot of us, we bat this around, and yet we don't even know what it is. We say, okay, we got to follow evidence-based medicine and best practices, but we just go, okay, we throw these words out there and we don't really know what they mean. So I went to the trouble to pull it off the ACA website. And here it is. And basically what this is, and best practices, and they stole it from the British Medical Journal, okay, which, okay, well, need to be uniform. Basically it says you need to go off of good experimental evidence and you also go off of your experience and practice, because we all discover things that isn't generally known. So, and that's why we go to people's seminars and we take a variety of seminars and we put our own methods of practice together. We find some things work really well, some don't, some work sometimes. And so this is where we learn the art of it. And then we actually discover things that aren't generally known, that we've discovered in our own practice working on people. So that combination is what evidence-based medicine and best practices are. So we have a copy of that if you want that. I think you can request it, off of just checking a box there. Okay, videos. So we have videos of first 3 classes, and we're going to go over those. And the 4th one is made, and we're editing it right now. We're having a few technical difficulties. It's such a long video, because when I give the classes on the first 3, we stop and let doctors work on each other. The 4th one is kind of agonizing, I know, because all people do is listen to me talk the whole 16 hours. But that is, as it is, it's a huge video, and it's causing the videographers' files to keep crashing. So we're trying to figure out how to do that. We made it about a quarter of the way through, and he's, I think, having to get a bigger computer in order to handle it. But anyway, we're going to address it. So part 1, 2, and 3, those are out. They're actually in post-production. But if you order the next couple of days, I will give it to you for the pre-production price, which is $250 each for a year's viewing. Okay? And after that, it'll go back to the $500. So you have a couple of days to do that. You can call me, 469-995-9907, and I'll put it in here, 469-995-9907. And basically a good thing about these videos is you can watch them as much as you want. And I suggest that you watch them all the way through. Then we have timestamps on them, so you can click at the bottom and a timestamp will drop down, and we have each clip labeled, so you can go down and find the clip that you want to look at and just click on that and watch it over and over as many times as you want to. And we also I have some written notes with them, the same notes that I put with the classes, so you get all those with these too. And of course you get to keep the notes, you can download those, but the film you just get to watch, including any upgrades, for a year. You can also go online to ttapcenter.com, click on Seminars Professional, then go to the seminar you want, 1, 2, 3, or 4. Under requested location, type in film and your phone number. Then click the down arrow by $395 and choose $250. And as soon as I see that, I will, at least by the next day, I will click it and get it right over to you, so you can immediately start reviewing it and watching it. Now, what are they about? Okay, film 1 is use of myotatic reflexes to resolve pain and biomechanics, chronic neuromuscular skeletal conditions. Basically, we're using reflexes and maybe some minor scar tissue that occurs in skin. And you'd be amazed at what you can do just with simple reflexes. These aren't reflexes you're familiar with at all. You can get somebody off a cane or walker in 1 or 2 visits, or standing up out of a wheelchair in just a few visits, if it's due to weakness instead of paralysis. When you see these things working, I mean, they're so instant. It's just unbelievable, and it's miraculous. And it's so easy to do, too. Immediately restore significant range of motion. Understand how reciprocal innervation can immediately help restore function in distant parts of the body. Correct foot drop in the majority of cases. Cogwheel rigidity of arm and leg, like from stroke and cerebral palsy. We've done this in class on people that were brought in. Don't care how many years they've had it, we can get the rigidity out just in a matter of seconds. It's just something when you see it. Improve hearing and tinnitus in most cases. In most cases, quickly and significantly reduces or eliminates the following symptoms, and it fulfills the ACA evidence medicine and best practices. To give you an example, and I read these off because you probably all have patients that have these things, and I'm trying to motivate you to go to the seminar, get the film, learn how to do this stuff. Know that you can help these things. Fibromyalgia pain, sciatica, using Lasix. You use standard orthopedic neurologic tests. Do it before and after, and it shows a correction. So this isn't just something that's kind of voodoo and you do it, and no, you can do standard tests and show a before and after. Herniated or bulging disc demonstrated by Milgram's. Unoperated rotator cuff, frozen shoulder, regional pain syndrome, formerly RSD or now complex regional pain syndrome. Burning in upper and lower extremities, genitals, female cyclical menstrual pain. You can have somebody that may have menstrual cramps and have them gone in a matter of seconds on the table. Vaginal prolapse, numb hands and feet, drop transverse cuboid arches, hyper and polyhydrosis, cranial nerve symptoms such as nystagmus, strabismus, and shown by Weber's, ear type of things, just standard tests. Carpal thoracic tunnel syndrome, Phalen's, reverse Phalen's tunnel, and Addison's test, burning or cold hands or feet, Raynaud syndrome, loss of vibration sense in the feet and toes, dizziness and vertigo, positive pinwheel test, bladder leakage. Yeah, you don't need those adult diapers. We show you how to get that out of people. MS, Parkinson's symptoms, ALS, Guillain-Barré symptoms, seizures. We show you how to stop a seizure in 15 seconds and keep them from coming back. That's all in part one, folks. Very amazing stuff. This is not reflexology, AK, CRT, PNT, TBM, transverse friction massage, spinal reflex therapy, contact reflex analysis. Nothing you've seen or heard before. It's based on known tenets of acupuncture, trigger point therapy, reflexes, and neurology, found in Laws and Tenets in Dorland's Illustrated Medical Dictionary, Chusid's Neurophysiology, Guyton's textbook, Medical Physiology, and others, taught in CC Accredited College. We show you out of these books as we go. It's in the notes. And I'm not just saying it, we show you in the notes. Treatment effects are verified by standard orthopedic neurologic examination. I am published JMPT in chiropractic economics on techniques being taught. I'm a former adjunct faculty member of postgraduate division, Texas Chiropractic College. Now, this is reflexes alone with maybe minor scar tissue getting profound effects, minor scar tissue in the skin getting profound effects. So this takes very little pressure, very little strength to do this. Then film 2 is dense scar tissue outside the joint. Now, the first thing we do in this first 4 hours is actually a continuation of part 1 because we didn't have enough time to teach it. We show you how to easily test over 200 muscles in the body in less than 10 minutes and immediately strengthen all the weak ones, except extremely atrophied ones take longer. There's usually not much of that. We show you how to find one and touch the muscle like this, and immediately all the muscles go strong. You immediately go back. I don't care if it's 3 weak muscles or 53. People who do this in class, they can't believe it, but it's so easy to do. And I've had 7 diplomates of applied kinesiology take the course, and they're just flabbergasted that Goodhart and Walter didn't come up with this. Well, I show you the reasoning. I always show you the reasoning and how I came up with these things. because I know you're going to improve on what I found, and I want you to. That's how progress occurs, okay? The second thing is how to palpate the whole body in easily less than 5 minutes. Again, these 200 muscles are easily less than 10 minutes. Now, I don't care how many painful spots that you find, i.e. trigger points, lightly touch one spot like this and immediately go back and press, and the pain's gone. The only exception being if there's a lot of inflammation, that even will go down by half immediately. And it'll just take a little while longer for it to go down. And these things just, they speed up how long it takes you to get somebody well. And it just amazes the patients and really ups your referrals, okay? And we'll talk about that here in a little bit. Here are some of the things. Right after we do that, we show you how to rehab somebody in about 1/4 of the time that it's normally taking, and we show you why. We show you all the sensibilities about it and why we do it that way. And it's very replicable. And then we show you, now, we've been kind of bamboozled by a ART, Graston, transverse friction massage to believe that everything has a lot of dense scar tissue associated with it. Part 1 and the first part of Part 2 shows you that just isn't true at all. But ART, right in their seminars, say it takes 4 to 6 visits to free up the scar tissue in a muscle. Graston, with their expensive tools, $650 to several $1,000s in tools, takes 6 to 10 visits. Transverse friction massage, Cyriax, right in his manual, states it takes 10 to 20 visits to clear it out. And they go away. It's very painful. You feel bruised. We show you how to normally clear up scar tissue in 1 visit, taking only seconds, very little effort on your part, very little pain and discomfort relatively to the patient. 1 visit normally, okay? Here are some examples. Chronic athletic injuries, which of course these can carry over to regular patients too. Hamstrings, ankles, wrists, golfers and tennis elbow, rotator cuff, knee problems, turf toe, shin splints, chondromalacia patella, weak ankles, trick knees, plantar fasciitis, myalgia paresthetica, bronchitis and asthma, gagging, esophageal spasm, reflux esophagitis, and put hiatal hernia in there, TMJ syndrome, migraine headaches, chronic whiplash, chronic hip, knee, and ankle, shoulder, elbow, and wrist pain, tendonitis, bursitis, adhesive capsulitis, frozen shoulder, Dupuytren's contracture, trigger finger, Osgood-Schlatters, chronic fever and sore throat, scar tissue and acupuncture methods, old fracture and chronic pain, bone, sclerotone pain, fibromyalgia, burning pain, resistant sciatica, spondylolisthesis, small joint fibrous ankylosis, chronic shingles pain, arthritic finger and toe joints, unadhere organs from each other, stimulate circulation and lymphatic flow, diaphragmatic and accessory breathing muscle function. We show you how to do endonasal techniques, including balloon nasoplasty, eustachian tube techniques for chronic sinusitis, chronic migraines, true eustachian tube deafness, Meniere's syndrome, female cyclical pain, vaginal prolapse, dizziness and vertigo, dropped arches, unexplained chest pain, MS Parkinson's, ALS, Guillain-Barré syndromes, ankylosing spondylitis symptoms, seizures, fibromyalgia, burning pain, resistant sciatica, spondylolisthesis, herniated or bulging disc, hearing loss, different frequencies, all the tunnel syndromes. Now those take care of dense scar tissue outside the joint. Now we're left with dense scar tissue inside the joint. So this is Part 3 film, Part 3 seminar. Adjusting, manipulation, mobilization, extremities, cranials, and vertebra. Now I've had over 100 different vertebral pelvic adjusting seminars, 32 cranial, 37 extremity seminars. So I drew off of those and came up with my own methods. And my whole thing is you don't really need a lot of force if you do it right, and you can get tremendous changes. Now, I've seen over 40,000 patients from all 50 states and 97 countries, over 3,000 upper level and lower level athletes, including over 800 of which were professional athletes, taking care of 12 professional athletic teams, and run an NFL Run for Daylight and Fastest Man competition. I was the first chiropractor asked to come there and treat athletes. Get most athletes back on the field in days in most cases, even if off for months. And you'll notice that a lot of these things carry over to regular patients. This isn't just athletes. And I bring those up because you haven't lived until you've treated a 73-person football team. You had to treat all the athletes, all 73, in an hour before the game, all of them at halftime, all of them in an hour after the game. So basically, in about 5 hours, you've treated 220 visits. But you have to be quick, you have to be efficient, you got to get really quick results. That carries over into the practice, okay? So we show you how to help ribs and costal cartilages, golfers' tennis elbow, chondromalacia patella, bunions, dementias, high arches, flat feet, dropped arches, reflux esophagitis, esophageal spasm, upper GI conditions, hiatal hernia. By the way, the hiatal hernia treatment is an actual osseous adjustment. It's not adjusting the stomach down like we're mostly taught. What we show you is actually what's causing the hiatal hernia. The other just patching it up. Chromium sternoclavicular joints, chondritis, costochondritis, hallux rigidus, hammer and claw toes. Had people in the last 2 seminars use it on their claw toes. They immediately straightened them out, and they'd had them for years. Just amazing stuff. Bow legs and knock knees. We show you how to correct those things. And it's amazing how quick you can take people out of those. Frozen shoulder adhesive capsulitis, rotator cuff, all the tunnel syndromes. Now, I'm the only chiropractor in Texas, second largest state, to be on the referred doctors list for autistic children. It's because I've gotten autistic children speaking sentences after only squeaky voice or speaking single words. We get them to speak words, then sentences, then paragraphs, and they go back in the class with normal kids. Now, a chiropractor recently called me up. He says, "You're not going to believe what happened." I said, "Try me." He said, parents brought in this kid, and he had autism. He had never spoken a word ever in his life. He was 5 years old. I did your procedure, which, by the way, is very light force. It takes about 3 minutes, start to finish. He turned around, looked up at me, and said, "Thank you, doctor." First 3 words he ever spoke. Doctor started crying. Both the parents started crying. This stuff is powerful, folks. One of the things, dementias on here. You see dementias? We show you how to get people out of dementias by adjusting the knee. And it's quite, I've done it in class on people. People have brought people with dementia in, and they immediately start recognizing people and talking, even though they hadn't talked for 5 years. Just very amazing stuff. Stop elusive migraines, improve hearing, improve elusive organ and gland dysfunctions, correct TMJ dysfunctions. One of the first things we teach here is how to put stress on joints of your digits and get amazing changes through the whole body. Totally unique type of stuff. People don't believe it when they see it. We had this last seminar, chiropractor in his mid to late 70s, had prostatitis, killed it by working on his big toe in class. I have his signed testimonial that he gave afterwards. It's just amazing stuff to see. You don't want to miss that. Okay, now these first 3 seminars deal with the nervous system. The nervous system controls the secretory and excretory events of the body. And we tell people, you've had people that haven't responded to nutritional intervention. And one of the things this does, since the nervous system controls secretory and excretory events of the body, is that they're automatically corrected because you didn't realize that it was a neurological issue. And now we're giving you more tools to correct that. So you're going to find that you need far less nutritional intervention than you ever needed to. And a big thing about these classes we're giving you is to help you know what to do with nutritional intervention. But this is what part 4 is about. Strict body chemistry type of issues. Okay, Eric DiMolanta, I can testify these videos reinforce the knowledge techniques you impart in your seminars. Necessary if you want absolute proficiency. No BS. Thank you, Eric. I appreciate that. Okay, TTAPS part 4, biochemical individuality strategies. Now I have a Master of Sciences in Biology emphasizing human nutrition. These were in class. They shipped in top instructors from top universities like Vanderbilt, USC, UCLA, Harvard, Yale, Columbia University, Princeton. They shipped in people from all those places for that. I'm also a master herbologist and master acupuncturist. I've been a member of 6 nutritional, medical, and scientific boards for major nutrition companies to make formulas to sell, okay? Now, I've performed over 15,000 nutritional assessments. Now, I use those things, and if you've had my experience, you go, why isn't this stuff working better? And I couldn't understand it because, everything seemed pretty straightforward, and I'm going, what am I missing? I'm going, they didn't teach us about food. So I did a many years, decades type of study on my own, and for several years I purchased and read cover to cover every month an average of $1,000 worth of technical books and research reports to figure this stuff out. And there's a lot of stuff lost to time. These guys were miracles in the past. I'm reviving a lot of these things for you guys in these sessions. We talk about that in part 4. So please don't miss that if you're really serious about body chemistry issues. Strategies to accelerate correction of allergic to virtually every food. Phil, they can't eat anything. So we've all had people who come in, they get the patch test, blood samples. They say, you're allergic to everything except 5 or 6 things. And they give them shots every week. Well, I had somebody coming in getting shots for 28 and a half years every week. We got her off the shots. You get people off of seasonal allergies when it's going into spring or autumn. The pollen is up 4 to 5 times higher than normal. People have really hard times. We get people not to react to it. We get people able to eat a lot of things. We show you how only a few things are causing you to be sensitized to a lot of other things. We show you how to figure that out because those other tests don't do it. But yet it's in the literature, okay? Autoimmune disorders that really aren't. We tell you what autoimmune actually is. Dysmenorrhea, excessive and prolonged flow. How to correct osteopenia, osteoporosis, and fracture. Natural antibiotics to help with infections that are recurring. Both spot infections and whole body, endogenous poisons, metabolic intermediates, hormone imbalances, seizures, ulcers, bleeding ulcers, constant bloody noses, fungal and candida infections, chronic fatigue, thyroid type of conditions, weight loss roulette, behavioral disorders, hypertension, bone demineralization, depression, hyper and hypothyroidism, hyper and hypoglycemia, failure to digest, absorb, metabolize, secrete, and excrete, acid-base imbalances, and it's not what you think. So basically, to get you to understand it, we show you the literature, and I teach you how body chemistry processes progress through the body and what negative feedback loops were. You can't live in these bodies on this earth without negative feedback loops. We show you what about hormones and enzymes and all these things, and things that you're kind of aware of but not totally. We really try to take the cover off of it so you can really see it for what it is and get super quick results in very difficult cases. And that's part 4. So I would urge you to order those while it's still at the $250 level, and go ahead and order those next couple of days so you can get it, and take the class when you can. Now we're going to talk about a couple other things. I do mentoring, and here are a couple of mentoring testimonials, and I have more that we're going to put up probably next time. I added some since last week. I've been mentoring over the last about 2.5 years because I was asked to do it because basically I had the largest practice in the world for many years, and I have a lot of stuff that can really help you get the practice that you want, okay? And I mentor people that are just starting. I mentor multi-million-dollar practices. We have a guy with a multi-million-dollar practice. After his first year with me, he doubled, 87% increased his profitability. The second year he was with me, 66% increase in profitability. So he over, like 1.5 times his profitability in a 2-year period. And, we show you how to get more patients, even if you don't get more calls than you're getting, because there's an echelon here. If you get 10 calls, on average, a practice that gets 10 calls, they're calling to inquire. 7 or 8 of them will set an appointment out of 10. And then out of those, only 7 or 8 will show up. So now you're down to 5 out of 10 that called in. Now out of those, maybe 2.5 or 3 will actually follow through. Well, we show you without even getting more calls how to capture 9 or 10 out of 10, get them to set appointments and to come in and to follow through. So we show you how to immediately triple or even quadruple your practice, getting no more calls than you're getting now. But we show you how to multiply those calls too, okay, in many different ways. Dr. B's mentoring is second to none. Wealth and knowledge. This fellow is in California. Dr. Bonebreak's mentorship program is the best investment I ever made. I thought I was a good doctor before meeting him. This doctor is in Cleveland, Ohio. Since mentorship with Dr. Bonebreak, I've seen several improvements in my patient practice, getting desired results, etc., etc. He was from Chicago, really upped his practice, and he said, I've always wanted to practice in Chicago. So his wife and him up and moved to their dream place in Florida. They'd always wanted to move there, so they said, okay. So I'm mentoring him there, helping him to start from zero with a partnership there. And they're already flying. I wasn't sure if I needed a mentor, as I already thought my business was very successful. And he saw things happen on himself, his brother, and several other people at the seminar. He's in Houston. Very successful doctor. Can't believe how much my practice has changed and grown since I began mentoring with Dr. Bonebreak. Here's a fellow in Fort Worth. I've been in private practice for 23 years, own and operate a successful chiropractic sports medicine clinic in Austin. It's a no fluff, no cookie cutter, no one fits all approach. I want to know how you want to improve your practice. You usually know where the holes are. You know what your goals are. I'm not going to try and tell you what your goals are like these other people do. Okay? I've been through 32 practice management, practice consulting, and coaching programs. Okay? I always rejected that. This is just like learning ways to adjust. You pick and choose things out of it, and you hope you improve. I want to know where you think your holes are, and I say, okay, let's go for that, and let's help you with that. I want you to carry around a small notebook with you at all times, all day, all night. You think of something you want to talk about, you write it down, because we have 1 hour sessions, and I want to answer years, folks. 640 new patient calls every month. Not every year, every month. The largest practice in the world. There's no reason you can't do it. If you haven't noticed, I stumble over my words. I can't even spell. Okay? But I know how to run a practice. If I can do it, my wife says, I've been to your seminars. I don't know how people don't fall asleep in your classes. Okay? Let alone your patients right in front of you. Okay? But even with all my faults here, I can show you how to have the practice that you always wanted, whatever that is. Okay, and you're the one that has to determine that. If you want to make global change, fine-tune your skills and practice, you want to have Dr. Bonebreak as your mentor. Okay? I'm telling you, you don't need David Singer's personality. If you haven't noticed, I don't have a personality. I certainly couldn't be David Singer. Neither could probably most of you. You don't need that to have a wonderful practice. My practice was far larger than Singer's was. This fellow's in Lubbock, Texas. Having been a sole practitioner for 20 years, I've seen my fair share of seminars, experienced a plethora of consult techniques. Frankly, I thought I'd just about seen them all. I was wrong. After attending my first TTAP seminar by Dr. Bonebreak, I knew I'd be going to all his seminars my first day in the office. Saw immediate results. Okay? This fellow's in Houston. Okay, and like I said, I got more of those which we're going to show you later. I'm here to help you get the practice of your dream. I'm doing it with these free seminars on Thursdays through the in-person seminars. We're going to be putting them online after we get the videos up. It's with the videos. It's all this. I want you to have the practice of your dreams and get the results that you want. That's the bottom line. So now we'll talk about the mentoring itself. You've seen that people that I've been mentoring have been having great results. We call it preeminence mentoring. Why do we call it that? You do just really good. You become preeminent in your field. That's what I want to see you do. Become preeminent in your field in the way that you want to be preeminent. Okay? It enables you to become top level, rapid, efficient patient response with scientific methodology found in medical literature. Become a nerve and biochemistry expert. We want you to become expert. Again, I want you to be able, any situation in your practice, I want you to be able to listen, immediately know what to do, and act without having to think a lot about it. That's what all of this is about. Okay? Get referrals from everywhere. Get paid what you're worth. Like I said, I've had patients from all 50 states and 97 countries. Folks, there's no reason you can't have that. Get paid what you're worth. Low stress, better family time. Others committed your lives. Now it's your turn. Now I want you to just close your eyes. Just imagine the business of your dreams, smooth running, plenty of highly satisfied and enthusiastic patients, as many as you want. Financial security, time to enjoy with your family, time to exercise regularly, great health. 3 reasons it works for you. Because you will devote the effort, time, and dedication to get what you want. I can't do it for you, but I can direct you how to do it. Okay? Charisma is obviously not necessary. If I can do it, you can. So I don't have any charisma. Group or one-on-one mentoring is very affordable. Next step, commit to be superlative. Go to the link, ttapcenter.com. Choose the mentoring level that fits you. Commit to change your life. mentoring levels. You have 12-month group mentoring. It's a one-on-one, 1-hour session. So you listen to others asking questions, you put your questions in, you hear me interacting, you hear me answer what's going on with them. It's $250 a month or one payment of $2,500 saves you $500. So you get 52 sessions with others. You get talk about whatever you want to and listen to everybody in that. Now, if in the first 3 months you want to go to 1-year one-on-one mentorship, you can go up to that in that time. Basically, you got to commit to get your dream practice. Now, the next level is 6-month one-on-one mentoring. You get a call a week for 26 weeks, a half a year. First one is for 52 weeks. It's 26 weeks, only it's one-on-one with you. So we're only talking about your practice, $1,000 a month or one payment of $4,000. So you're saving a third, saving $2,000. Get to talk about absolutely any aspect of your practice that you want to. If you decide to step up to the one-year mentorship in the first 3 months, you get all months, you get those benefits. So what's the one-on-one? You get 52 weeks one-on-one with me. 1-hour call every week. It's $1,000 a month or one payment of $8,000. Save a third, save $4,000. It includes all the films in this, and the other ones you don't get the films with it for a year, okay? Year's viewing from the time that they're fully out. After these films are done, I have thousands and thousands. I've trained over 2,000 doctors in my seminars, in-person seminars, and I have thousands and thousands of doctor testimonials and patient testimonials where we're going to create a link for each of those 4 seminars. And the benefit of this, we're going to put it in alphabetical order so patients can look up their conditions in alphabetical order and see that you're saying, oh, I went to this TTAP seminar, it's so great. And they're going, oh, yeah. But now they'll be able to go through this link and see that the doctors and patients are saying it's great because it worked on the patients. The doctors are saying it's worked on those their patients. Now, when I did this on mine, I put one up just out of my own experience. And one for each of these parts. And it was worth 20 new patients for each part per month. And I sent out emails to my own patients, and they went on, and several of them were up 20 every month. So I got essentially 160 new patients every month, because the patients that I was already taking care of said, I didn't know you could take care of this. I need to come back in and get that taken care of too. Okay? So that's the benefit of that. Even if you don't go with the mentorship, those are just $50 a month per part for that link when it goes up. So you can do that without getting the mentorship, but it's included in the mentorship for a year. We're also going to have a doctor's blog. So doctors, you'll get to interact with each other for a year. And one of you'll say, well, I did this and I got these results, or I'm having trouble with this. What would you do? And if y'all get hung up and you say, Dr. Bonebreak, what would you do? We're getting hung up on this. Then I'll jump in and I'll do it. I want you to be able to get results. I want you to be able to handle things in your office. I want you to have the practice of your dream. I want to take the stress off. I want you to have a great income. Okay? I want you to have a great time with your family. That's what all this is about. So this is one-on-one for a year with all those benefits. You get all that in it. Now, if you decide to extend to another year, it's just half price. So the second year and thereafter is just half price. So it goes down to $4,000. Because I know, we're going to be very familiar with each other, and we click. It takes a while to click at the start, but it gets easier. So I cut the price in half after that first year. Now, what do you need to do? You need to commit to achieve your dream practice. It takes commitment. Business results depend on effort and following directions. You got to lose your excuses, take consistent actions. If nothing else, I am a slow learner. Why do you think I had to take all those seminars and read all that stuff? I'm extremely slow, okay? But I try to make it fast for you so you don't have to go through all that I did to get there. I want you to improve, and I want you to improve quickly. If you'll do this, sign up. If not, don't. It's just that simple. If you're not going to take action, don't bother to sign up, because it ain't going to work for you. We give you the information and encouragement, but you're the one that has to take action to improve your life. That's basic. That's the basic stuff there. Okay. So I would encourage you to do that. Now, we're going to go back, and I'm going to ask, and I appreciate you taking the time to be here, but I'm going to ask now, do you have any questions whatsoever? Now's the time to ask, and I'm here as long as you want me to be here. We've been here for about an hour and a half. If you have any questions about anything, and I'm going to put my email here if you want to email me, drbbrk@hotmail.com, and my website, ttapscenter.com. If you want those notes of mine, I'm going to try and correct all the typos in it, and I apologize for that again. If you want to talk to me, it's 972-995-9907. Okay, so you can contact any of those. Tomorrow, I'm going to be up in the air going to give a seminar in Charlotte, North Carolina. But feel free to call me. After I land, I might be able to call you back if you want to talk. But communicate with me. Anytime you need help with a patient, regardless of whether you're a client or not, I will try to help you. Okay, I am here to help. If you need more help, become a client. I would suggest that you get the films. I'd suggest you go to the classes. Repetition is what gets it, and you all know that. Okay, so do we have any questions before we say goodnight? And we're going to skip next week because it's Thanksgiving. Okay, so it's going to be 2 weeks before the next class. Any questions whatsoever before we cut it off for tonight? I'll give you 30 seconds to ask questions here. So any questions whatsoever, please type it in here over in the chat box. Any questions whatsoever? Any questions whatsoever? Eric, thank you again for your time. Thank you very much. And Eric, email me. Let me know when your state's open there, because we still got to give part 4 in Chicago and Rock Island and in those areas. So let me know when your state opens. Okay. Thank you. Great again from David. Thank you. Okay. Going once. Going twice. Thank you so much. I very much appreciate it. And we will see you hopefully in 2 weeks. Have a great holiday.